For the Canada Emergency Response Benefit, or CERB. We'll tell you more about who can apply, when to do it, how to do it. I know many of you have already done it. We're also expecting the Prime Minister to talk more about the fact that some of Canada's big banks are in fact cutting their credit card interest rates after much pressure from the Finance Minister and from the government. So we'll take a closer look at that. I know many of you have had concerns about that as well. Prime Minister Justin Trudeau will address Canadians as he does every day from his home, Rideau Cottage, and we'll bring that to you live when it begins, followed, of course, by our regular federal briefing by cabinet ministers and federal public health officials. But let's bring in my colleagues. Vashi Kapellas, host of CBC's Power and Politics, and the CBC's David Cochrane here from our Parliamentary Bureau. This is a day that a lot of people were waiting for because it does mean that some help is on the way, and certainly if you look at my Twitter account, many people have already applied for the CERB, Vashi, and from anecdotally, again, just from the Twitter sphere, it appears to be going pretty well.
Yeah, the application process itself, Rosie, seems to be relatively hitch-free. And of course, going into this, that was a huge concern given the system that existed for EI and how overloaded that was. The government said they insisted that this new stream was set up in order to combat some of those technical difficulties. And by and large, again, anecdotally, it sounds as though the system itself is working. Now, that's not to say it encompasses everybody who had hoped that they would be encompassed by this program. There are still a lot of people, I'll highlight just for example, students or certain self-employed people or freelancers who feel like they are not able to access this program. And we expect to hear something about that from the Prime Minister, sort of addressing some of the gaps, not only in the CERB program, but also the wage subsidy and business program that was announced last week. So an acknowledgement that those gaps exist. I don't know exactly what the answer is to filling them, but I think the pressure continues to be on to the government to sort of, I guess, address the issue and try and figure out ways to mitigate some of the effects on people who don't necessarily qualify. I would highlight another issue as well that I'm expecting there will be a lot of questions on, and that is personal protective equipment and supply. We have been talking about this now for days. The context kind of shifted last week in that late in the week, the President of the United States decided to invoke an act that would limit production, the export rather, of those supplies to Canada, either block or limit them. I'm seeing notice now that Premier Doug Ford of Ontario conducted an interview with City TV in which he said that Ontario is about to run out of PPE in a week. I'm waiting to see the clip for myself, but certainly that is a major concern. Last week we heard from Quebec Premier François Legault, talking about that province running out. We know that there are big stumbling blocks right now thanks to the policy of the White House. And so I think there's a lot of questions that are going to be directed at the Prime Minister on that and how the federal government plans to address some of these huge issues.
Yeah, that's fair to say, for sure. Just on the side of your screen there, you will see some information, basic information about the CERB. You'll see that the government wants you to apply according to your date of birth, your month of birth, rather. If you do it anyway, it will go through. They just don't want you to do it all at once because they want the system to hold up, and it appears to be doing that. We'll talk to someone in a moment. David, what are you expecting from the PM today?
Yeah, Rosie, I don't think they wanted you to tell Canadians that because they don't want to overload the system. If it crashes, now we know who to blame. To build on what Vashi said about the gaps in the system, the CERB is a program that was built to get money out fast, but they know it wasn't perfect, though the sign-up rollout certainly seems to be going fairly perfectly today. What I'm told today is that we will get a very clear message from the Prime Minister that they do acknowledge the gaps in the system for people like gig workers, freelancers, contractors who've had a catastrophic revenue drop because of COVID-19, but not a 100% revenue drop, which is the standard for the CERB, and a commitment from the Prime Minister that they're going to take steps to address that. They wanted to get as much money to as many people as they could, which is why they rolled it out so fast. And as the Finance Minister said, it's hard to roll out a program quickly and cover absolutely everyone. So part of the process has been to roll it out, get the feedback from people of who has been missed and who has been caught in this, and then find ways to patch over those cracks in the system. So some specifics on that today from Justin Trudeau, and a broad reassurance that they are trying to make this as universal as possible. It's just they're working in a ridiculous circumstance right now in terms of designing policy, and that they're going to take steps in the next little while to catch people who have not been caught in this safety net that they've built on the fly. So that is what I think would be kind of the news coming out of this today, because we knew the portal would open, we know it's open, and we know it's been going okay. And just to build on what Vashi was saying, our colleague Cynthia Mulligan is from Citi, is the person who did the interview with Doug Ford, and what he's told her is that Ontario had a shipment of 3 million masks stopped at the Canada-US border, and it couldn't get in. And without the ability to resupply based on that, he says Ontario could be out of frontline personal protective equipment in about a week. I've been speaking with people at the federal level involved with procurement over the last couple of days. The ironic thing, because of the steps that Trump has taken, Canada is now relying very heavily on China. And they need a good week of shipments and a couple of plane loads coming out of China to make everyone feel a little bit better, which is why when you see people blaming China, as Donald Trump has done, for what's going on here, probably a reluctance to do that at the Canadian federal government level right now, because when you are relying so heavily on that country for the frontline medical gear that you need, that kind of tough talk doesn't really help your cause.
Okay, good perspective there, because I do know I myself have received emails and tweets from people who have not lost all of their income and are wondering what happens now. So if the government is looking to catch some of the people that may have fallen through the cracks, those people, and certainly students, the Prime Minister was asked about that again yesterday. He says they're on the case and they'll have more to say on that in the week ahead or the days ahead, because of course students trying to find work for the summer months to get enough money for tuition simply aren't going to find it right now. So obviously that's another big crack in the policy that the government is very aware of. Let's check in with someone now who has already applied for the benefit program today. Marissa Verdoni is a chiropractor who's currently at home with her 2 kids, and she joins us from Hamilton, Ontario. Good to see you, Melissa.
Hi.
So you applied. Tell me how it went. What time did you do it, and what was it like?
Actually, it was super easy. I wasn't sure how quickly I would get through. It was about 8 o'clock this morning. I decided I was going to try to do my application online. So I logged in. I do have a CRA account, logged in online, and there was an error message, which I'm not sure whether that just has something to do with my account or it's just a busy day. So I decided I would try to call in. So I did one phone call with a busy signal, and then I called right back again, got right through. There was a few questions. They asked me for my SIN, and they asked for my birth year. And then there was a recorded message that explained exactly what the CERB is, how you would qualify, and that you needed to make sure that you met all the prereqs in order to apply. And then once it went through that, I pushed a button. That was it. Just pushed a button, and then it just said you qualified. You'll receive your direct deposit within 3 to 5 days, and that was all.
That is pretty easy. Let's see if you get it in the 3 to 5 days. That's the part that has to come to an end too. So tell me what has happened to your income since the beginning of all of this.
Sure. So I'm a chiropractor. I'm a self-employed sole proprietor. I work as a contractor at a couple clinics, and my last work day was March the 20th. I went in for acute care patients. That's our college has allowed us to go in to treat acute or emergency care patients. It's really a gray zone right now. That was my last day of work, and since then I've not worked. My children are not able to go to school, obviously, or to their daycare. They've been closed since March the 13th. So I've been at home every day, all day, taking care of them.
And that is a full-time job. I know all parents can relate to that right now. So the CERB, if it sounds like you've qualified, you're going to get it in 3 to 5 days. How does that make up for your income loss, like in terms of covering your expenses?
It offsets some things. I mean, obviously, I would love to be at work, first of all, helping my patients, and second of all, earning an income that sort of meets the standard of what we're used to. But at least it's better than nothing. I think I probably would speak for most people saying that I'm at home, I'm safe, I'm healthy, my kids are healthy, and my family is healthy. And that right now, this is such an unprecedented time, that really is the most important thing for me. So any little bit helps. We're going to do the best we can with it, save it, and we're being really careful with what we're spending.
And your husband, I believe, is still working, so that obviously helps your situation too.
He is working, and it's funny because it does help knowing that he's still getting an income, but it's also actually it's scary because he's going into work every day. He's in manufacturing, so he's obviously been deemed essential service, and they're actually now going to be helping changing up their manufacturing lines and protocol, and he's quite involved with that in order to help make face masks, which is amazing. I'm so happy I feel so great that they're doing that. But it's scary because he's going into work every day, exposing himself. The company has taken some precautions, but most people are still going into work. There's about 1,500 employees, and coming home every day, stripping down, having a shower, doing the best things he can, washing his hands, all of those important things. But we don't know what's coming into the house every day. So that's scary, but I think mental health-wise, I think it's really good for him to be able to be at work.
Yeah,
that's been hard. That's really hard.
Yeah, it is. I'm sure it is. I get to leave the house too, and sometimes that does help. Yeah. So you said this will help. How long could you go, do you think, financially? If you just had this coming in, no one really knows, of course, when this is going to end. But how long do you think you could go?
Funny, when I was speaking to the gentleman at CBC, their screening earlier this morning, was asking, what do you think about if this happens, this lasts for 18 months to 2 years? And to be perfectly honest, I'm not thinking about that at this point. I really am just trying to take it a day, a week at a time, and doing the best that we can. No one really knows what's going to happen. I don't see myself being off work for that long. I mean, we are actually, at this point, able to see patients this way through teleconference. Also, we are able to go into work for emergency and acute patients, as I mentioned. And the clinic, one of the clinics I'm working for, has asked if I'm interested in doing that. The challenging thing, obviously, is exposing myself and patients to anything. But I don't think I'll be able to go that long without seeing my patients. Just the profession that I have, you just don't feel like yourself unless you're helping people. It's really hard.
Can I ask, is there anything else the government could do for you if they're listening as we wait for the Prime Minister? Is there anything else that you think people like you could use in terms of support?
Financially? Or just in general?
Anyway, anything you can think of.
I think the government is doing the best. I think the government is doing a good job, to be honest. I think they're doing the best that they possibly can at this point. Things are changing day to day, and we all have to remember that. I am grateful to have the CERB benefit. I do think it's going to help. I think it's going to help a lot of people. We all know who it's not really helping right now. In terms of me professionally, it would be nice if it was a little more clear in terms of what we are and aren't able to do as essential workers. But otherwise, I think that we're all doing okay. And again, it's just one day at a time. I mean, there's no point in complaining at this point. I feel fairly safe. So I think we're doing okay.
That's good. Okay is good enough for now. I agree. Marissa, thank you. I'm glad it went so well for you this morning, and appreciate you making the time for us today.
Thank you so much. Have a great day.
You too. Stay healthy. Nice to meet you. Marissa Rodoni in Hamilton, Ontario. All right, good to put some faces to this experience as people scramble to apply today for the CERB and try and make up some of their income. I'll bring back Vashi and David to talk a little bit more about that. I mean, I'm actually surprised that the phone worked so well as well in that case. So Marissa couldn't get through online for whatever reason, and she was able to call and get cleared. I think we have, maybe I'll put it up, maybe I won't, but we have the 3 screen captures of how easy this is. It is basically, if you get online, 3 clicks of your mouse. That's sort of it. Because ultimately, the government's goal is to get this money out the door as quickly as possible to as many people as possible. Vashi, I'll go over to you.
Yeah, and that's what they said right from the beginning, right? The idea is to capture a broad swath of the population. They had said that what you would have to attest to, the bar for that would be lower than, for example, EI, and that is the case. There's just a few questions that you basically have to say, yes, I don't have income, I have no income, et cetera, et cetera. Every month, you're going to have to do the same thing in order to keep accessing that money. But like you said, Rosie, it is pretty simple, pretty straightforward. So I think from a sort of technical application process point of view, this program looks like it's working. I would highlight what you did earlier, though, just to keep in mind, and I think as we listen to the Prime Minister, try and figure out where the government is going for those people who don't fit into the program. So people who have perhaps, the biggest message I keep getting is people who have lost the majority of their income, almost all of it, but not every single penny. So they're not at zero, and they are really, really struggling to be able to find some kind of help from the government at this point. So I'm very, very keenly interested to find out. Like you said, the Prime Minister yesterday acknowledged that there are gaps in both this program and the wage subsidy program. They are working on addressing those gaps. I'm very interested to find out exactly how they're going to do that, because as we've been saying over the past few weeks, for people who have lost the majority or all of their income, time is of the essence, right? Like, we're heading now into April, into another rent check, into another bill cycle, and I think they need that money.
Okay, here comes the Prime Minister of Canada. Thanks for that, Vashi.
Bonjour à tous.
Good morning, everyone.
I want to start this morning by recognizing that today is a painful anniversary. It has now been 2 years since the tragic Humboldt Broncos crash. From coast to coast to coast, we remember the 16 lives that ended much too soon and the many more that were changed forever. If you lost a friend, a teammate, or a loved one, if you're still rebuilding and recovering, I want you to know that we're here for you, and we will always be here for you. You, the community of Humboldt, along with all Canadians who stand with you, have shown incredible strength and resilience. And just like the people putting out hockey sticks or wearing the jersey, you remind us that together we can get through even the darkest of times. Right now, as we face a challenge unlike any other, we lean on our friends and family, and we let them know that they can lean on us, too. The weeks and months ahead won't be easy, but we're going to get through this together. I'm sure many of you watched the Queen's address yesterday afternoon, and her message of unity and resolve is more important than ever. No one should feel alone in this. No one should wonder how they'll weather this storm without support. Over the past few weeks, we've brought in a whole range of new measures to help families and workers, seniors and business owners get through this. Taken together, we've introduced the biggest economic measures in our lifetime, which will help millions of people. That includes the Canada Emergency Response Benefit for if you've lost your paycheck. Whether you're taking care of someone who's sick, have been laid off, or are living with a disability, the CERB is there for you. This benefit is now available starting today. If you're born in January, February, or March, you can go to canada.ca and apply online. If you can't apply online, don't worry. You can call 1-800-959-2041. Since it opened this morning, 240,000 people have already successfully applied. For everyone else, you'll be able to apply another day this week, depending on your birth month. We know you need this support as soon as possible. We have to make sure this system works for everyone. If you're using direct deposit, you'll receive money 3 to 5 days later. The CERB is meant to help all Canadians who need it, and millions of Canadians will be getting it starting this week. But there are some people who don't yet qualify, who we do need to help. If you're working reduced hours, down to 10 hours a week or less, we will soon announce how you will be able to qualify for the CERB. This is to help you if you're a gig worker, a contract worker, or a volunteer firefighter. We'll also have more to say for those who are working, but making less than they would with the benefit. I'm thinking in particular of home care workers or long-term care workers looking after vulnerable seniors. And I know there are also lots of university or college students wondering what kind of job you'll get this summer. You need support now, and work is underway to get it to you as soon as possible. For people in all of these situations, we see you. We're going to be there for you. And we're working as hard as we can to get you the support you need. At the same time, we also announced a new 75% wage subsidy to help you keep your job and help businesses keep their employees on the payroll. Right now, we're drafting legislation and talking to other parties ahead of bringing Parliament back to put the wage subsidy in place as quickly as possible, supporting you and your family is our top priority. Your Minister of Finance, Bill Morneau, will have more updates soon, but here's the bottom line. Whatever your situation, we are working to get you the help you need.
If you were born in January, February, or March, and you had to stop working because of the virus, you can now apply for the Canada Emergency Response Benefit starting today on Canada.ca. If not, you can submit a request later in the week, depending on your birth month. Many of you need help quickly, and we want to ensure that the system works for everyone. If you opt for direct deposit, it should take 3 to 5 days to receive an initial payment. The emergency benefit is intended to help all Canadians who need some assistance now, but I know that there are some people out there who still need support and are not yet able to qualify. If your hours have been reduced, for example, to, say, 10 hours or less, we will soon be announcing how you can benefit from the CERB. We will also have news about people earning less money now than they would with the benefit. I'm thinking, for example, of home care workers or people who work in long-term care work. And, of course, if you're in CEGEP or university, you're probably wondering what you're going to do this summer. You clearly need help as well, and we're working very hard to find solutions for you. At the same time, we are working on legislation and cooperating with the opposition parties to recall Parliament and put in place the measures we have announced as quickly as possible. The Minister of Finance, Bill Morneau, will provide additional details soon, but this is what you must remember. Whatever your circumstances, we are doing everything we can to help you. We are working very hard to give you some respite and help you to manage your financial situation. The banks have an important role to play as well, because they will be able to help businesses to continue their activities and families to pay their mortgages. Today, I want to thank the 6 major banks and certain cooperatives for agreeing to reduce by half the interest rates on credit cards for Canadians experiencing financial difficulty as a result of the pandemic.
Major banks and of certain credit unions to cut credit card interest rates almost in half for people in financial difficulty because of the pandemic will give them much needed relief on debt. I also want to thank Minister Morneau for his outstanding leadership on this. And we need to see even more action like this going forward, because this is a time to think about each other, not about the bottom line. On that note, I want to recognize the new initiative the Canadian Chamber of Commerce launched in partnership with our government. The Canadian Business Resilience Network will help businesses of all sizes get through this tough period, not just get through this tough period, but drive our economic recovery afterwards. This builds on what we've already done to help business owners. We have a 3-point economic plan. It supports business owners, including through new loans, while safeguarding jobs with the wage subsidy and helping those who no longer have a paycheck with the CERB. We're here for you. In order to get through this and keep our loved ones and our frontline workers safe, all Canadians need to do their part. Don't forget that you are shaping our future today. What the next weeks and months look like depends on you. It depends on whether you stay home, whether you help protect the vulnerable and make sure our hospitals aren't overwhelmed. Chaque citoyen doit faire sa part.
Every citizen has to do his part, because people who may have to go to work, such as lab technicians and healthcare workers, truckers and farm workers, are doing more than their share. They're making sacrifices to allow the rest of the population to stay home. The best way to thank them is to continue to follow the public health guidelines. That is how we can all protect our own health and their health as well. Thank you for being here today.
Monsieur le Premier ministre, on va maintenant passer à la période de questions en commençant par le téléphone. Modérateur, c'est à vous.
Thank you. Merci. The first question, Alex Ballingal, Toronto Star. Line is open.
Good morning, Prime Minister. Premier Ford in Ontario reportedly told CBC News this morning that Ontario could run out of personal protective equipment within a week, and that the U.S. has stopped a shipment of equipment last night. I'm wondering what your reaction to that is, that impending shortage in Ontario, and can you tell us if the U.S. has actually stopped any shipments of goods into Canada?
We are working very closely with all provinces and monitoring the levels of personal protective equipment and the challenges they're facing both on procurement and on making sure that our health officials, healthcare workers across the country get the kind of help that they need. We continue to have productive and positive conversations with the United States, emphasizing for them that healthcare supplies and workers across the border are very much a two-way street, and we need to continue to enable us to be there for our neighbors because it's in our collective interest. Minister Champagne had a good conversation with Secretary Pompeo this morning. Those conversations are continuing, and we expect those supplies to be delivered.
From the outset, we have been working with the premiers of the provinces to ensure that they have enough medical equipment to protect their healthcare workers. And we're very much aware of the concerns in terms of there not being enough equipment in the coming days. And that's why we are working very, very hard to secure those supplies around the world and also start to produce them here in Canada. I can say that we continue to have very productive discussions with the Americans. Minister Champagne spoke to Secretary Pompeo this morning, and we are expecting those products to be delivered.
Follow-up question?
Have you, I guess just to repeat that question, has there been any shipments that have been stopped that we were expecting to get? And have you received any assurances from the Americans that they will allow these to go through?
As I said, there are very productive conversations ongoing, and we expect those shipments to be delivered.
Thank you. Next question.
Thank you. Merci. Next question, Jim Bronskill, the Canadian Press. Line is open.
Good morning. We're wondering if you can update us on any of the efforts to ensure that people are quarantined who need to be quarantined. Do you have anything to tell us today about whether anyone has been quarantined? And if so, are there any numbers on that score? Thank you.
Anyone returning to Canada is subject to a mandatory quarantine order. That means they have to go straight home from the airport and stay home for 14 days. Public health officials are following up with a number of those people, particularly some of the higher risk or challenging cases. We are confident that Canadians right across the country are obeying the quarantine orders and making sure that they're doing everything they need to do to keep themselves and their loved ones safe.
Follow-up question?
Is there any sense beyond the normal quarantine procedures whether the Quarantine Act has been invoked in special cases and people have actually been forced into quarantine in centres or other locations under the Quarantine Act?
From the very beginning, there was a number of measures that we took on returning flights from Wuhan, for example, on flights coming back from various cruises where we had mandatory quarantines in centres. We have facilities available for people who are returning to Canada and for various reasons cannot quarantine themselves at home, or home is too far from the airport. That is why we have institutions in place, and those are being used.
Merci beaucoup. Prochaine question.
Thank you. Merci. Prochaine question, Raymond Filion, TVA. À vous.
TVA. Good morning, Prime Minister. About a week ago, you were talking about the end of your isolation arriving. Can you tell us when that will happen? Well, I intend to return to the office in the coming days, but my work will continue for the time being at home. We know that that's what we're asking everyone to do. We're telling people to stay home as much as possible, and as we've seen in recent weeks, it is possible to do so, and we're working very well from home in this particular circumstance. Yes, I may have to go back to Parliament or go to the office at some point in the coming days or weeks, but I will continue to work from home as much as possible. You also mentioned in your statement that the coming weeks and months will not be easy. Could you elaborate on that? I understand that the CERB depends on the choices people are making, and you will be releasing information, but in concrete terms, what does this mean? Well, it means that people should expect to continue to stay home for many weeks and perhaps many months. We will have more specific answers for people once we have completed our modeling, and that will give people a better idea of what could happen. But every model and every projection shows a lot of variability depending on the actions that we take as individuals and as a society. Staying home and continuing to be isolated and practice distancing is the best way to come out of this as quickly as possible. But this will be an issue that lasts for weeks and possibly months.
Thank you. Merci. Dernière question, Marie Vastel, Le Devoir, à vous.
Le Devoir. Good morning, Mr. Trudeau. I'd like to hear you comment on Parliament. Work has been suspended in Parliament for 3 weeks, and that means the democratic process is not really underway, and yet you're a minority government. So what do you say to people who think that you are getting around the opposition parties and that you're governing all by yourself? On the contrary, that is exactly why we are recalling Parliament to debate very important legislation that will help workers and businesses with the wage subsidy. And I'm looking forward to being in Parliament and seeing it recalled in reduced numbers so that we can continue to do our important work as parliamentarians. At the same time, it's important to say that there are many parliamentarians right across the country who were elected to represent their communities that simply cannot come to Parliament at this time, and that is why we are looking very seriously at ways of bringing Parliament together virtually. We know that it's important to allow our democracy to continue to fully operate, and we want to give an opportunity to all MPs, not just those who live close to Parliament, to represent their citizens, and we will continue to work on that in the coming days and weeks. And about the idea of a virtual parliament, what kind of model are you looking at? Would you be prepared every single day for question period, or would it be something more flexible since we're in a crisis? Well, I think there are a lot of good ideas that we're hearing in terms of how we can make our processes and our institutions more robust in this crisis. And I think that it's even more important now that we have a strong democracy and strong institutions when we're dealing with a crisis. And that's why we're working with the other political parties and our institutions and parliamentarian experts in order to continue to give confidence to the people of Canada that our democracy is working, that Parliament is working, and that we remain strong even in these difficult times.
Really important that we continue to strengthen our democracy even during a crisis, especially during a crisis. That's why I'm looking forward to seeing Parliament reconvene in a reduced state in the coming days to be able to pass important legislation that's going to get wage subsidies out to employers so people can continue to hold their jobs even in this time where very few people are working. But more than that, we have to look at ways of virtually convening Parliament so that parliamentarians from across the country who were elected to do their jobs of representing their citizens in normal times and in times of crisis can make themselves heard. It can't be just about folks who have proximity to Parliament or the ability to get here. We need to look at ways that our democracy and our institutions can stay strong and embody and fulfill the functions that Canadians need them to. That's why I'm very much looking forward to discussions with other parties and experts on how we can continue with our institutions even in this difficult time.
Bonjour, Monsieur le Premier ministre. Christian Trudeau de Radio.
Christian Noël, Radio-Canada. No, I haven't changed my last name just yet. Now, the Canada Emergency Response Benefit, there are a lot of people who are falling through the cracks at this time and wondering what they're going to do and how long they can last. So what kind of changes will you make to fill in those gaps, and will it be retroactive? Well, we are currently looking at a couple of different type of people who are falling through the cracks and are not eligible for that benefit. We have seen people with massively reduced hours, but who are continuing to work and who should be able to access the CERB. Some people may be working only 10 hours a week and are earning only $500 a month, and we believe they should have access to the CERB. So in the coming days, we will be announcing how those people can apply to receive the Canada Emergency Response Benefit. We also realize that in some areas, for example, in long-term care facilities, there are workers who are earning less per month. They're carrying out very important work for society, but they're earning less than what they would receive under the CERB, the new benefit. So we want to ensure that those people who are doing this important work can continue to do it, and we're now looking at how we can give them a bit more money so that it would be worthwhile for them to keep those jobs and continue to do that work. Once again, we will have more to say about that in the coming days.
The Canada Emergency Response Benefit is there to help millions of Canadians. We've moved quickly on it to try and help as many people as we possibly can, as quickly as possible, and that's rolling out today. But at the same time, we recognize that there are groups of people who aren't benefiting from the Canada Emergency Response Benefit who probably should. I think specifically of people who've seen their hours reduced massively down to 10 hours a week or less, maybe making a total of $500 a month, who are in a precarious situation, who really would and should benefit from the Canada Emergency Response Benefit. So we're going to be announcing in the coming days how people in that situation will be able to apply and receive the Canada Emergency Response Benefit. Think of other groups of people who, perhaps people working in long-term care facilities or seniors' residences, who do extremely important work, particularly these days, but who actually don't make as much per month as they would if they had lost their job and were receiving the response benefit. That's why we're looking carefully at how we can increase their pay a little bit so that they do better off remaining at work rather than receiving, going off work and receiving the emergency response benefit. These are fine-tunings that we knew we would have to do because in any program you're trying to help as many people as possible. There will be exceptions that we have to fill, and we're going to keep working to make sure that we get this right and get everyone the help they need.
Pour ce qui est des petites et moyennes entreprises, puisque la croissance économique prévue pour le deuxième trimestre, c'est pas une croissance, ça va être une décroissance. Les PME, c'est le moteur de l'économie. La subvention salariale de 75% ne fait pas leur affaire pour toutes les entreprises. Donc,
now, the fact is that the wage subsidy does not suit all businesses. What can you do about that, and what can you do to stop the steady decline in the economy? Well, we're in a situation right now where what we have to do to deal with the health crisis is harming the economy and creating an economic crisis as well. But we have choices to make. We have no choice but to shut down the economy in order to come through this crisis as soon as possible, so that we can get those economic engines up and running again as quickly as possible in a few months. And in order to get through these difficult months, we are providing assistance directly to workers and businesses so that they can last out this crisis with the wage subsidy, with loans and access to credit, with funding for large corporations as well. So we are there to ensure that when the economy rebounds at the end of this crisis, we will be in a good economic position and will be able to get the economic activity back up and running again.
Hi, Prime Minister. Tom Parry with CBC. I just want to return to that City News report about the shipment of masks. Did the United States block that shipment of masks to Canada? Are you aware of any other shipments that have been delayed or blocked? And you said that you expect the shipment to arrive. If it doesn't, what are you going to do?
Okay. We continue to have constructive and productive conversations with officials in the American administration who understand that essential services and supplies are very much a two-way street between Canada and the United States. We are interconnected and interlinked in so many ways, from primary resources flowing to American companies to make the equipment that is so desperately needed both in North America and around the world, to actual shipments of products that go from Canada to the United States, that go from the United States to Canada. We will continue to work together. We're going to make sure that goods and services that are essential continue to flow, and I expect those shipments to come in soon. Okay. Nous savons que les biens et services essentiels
essential goods and
vont
services
des deux côtés de la frontière.
Cross the border in both directions, and we will continue to work with the Americans to ensure that those essential products to protect Canadians come to Canada, and we are confident they will.
The Centre for Disease Control in the United States is recommending that people wear masks when they go out in public. Canada hasn't gone that far. Why is there a reluctance on Canada's part to make that kind of recommendation, given that some healthcare experts say it's a good idea?
I'm not going to make health recommendations to people. I don't think politicians should be opining on health solutions or fixes. I know that Dr. Tam is going to be sharing new reflections on masks in less than an hour now. And I encourage people to continue to listen to her and to health experts and professionals on how best we can keep ourselves safe, how best we can keep our loved ones safe, how best we can keep our healthcare workers safe at this time.
Brian Mullen, Global News. Prime Minister, some of the countries that have had the most success flattening the curve, such as Germany, attribute that to testing. So why aren't we doing more testing? Is it lack of people to administer the tests, lack of testing kits, or a lack of resources?
Every single day we are doing more tests than the day before. We recognize that large-scale testing is a key element of flattening the curve and dealing with the long-term prognosis of this pandemic. We will need to continue to test more and more to get those answers back quickly and be able to monitor the spread of coronavirus through our population. That's why we're continuing to do more tests. That's why we're creating more test kits. That's why we're continuing to develop new solutions on testing. Testing will be an essential part of how we get through this.
We recognize that testing is essential when it comes to our ability to get through this pandemic. That's why every single day we are doing more testing, and it's also why we are securing new test kits, a larger number of kits, so that testing can be done more quickly, because we know that getting through this means massive testing. testing.
Testing kits purchased by the government be delivered to the provinces so that testing can ramp up?
We've already had deliveries of testing kits, and we will continue to deliver more and more testing kits from around the world, from companies in Canada that are developing them. We know there's a need for more testing kits, and that's what we're working on.
Prime Minister Kevin Gallagher with CTV National News. We're hearing that healthcare professionals, nurses, doctors are being told by hospitals on border towns, specifically Windsor and Sault Ste. Marie, they have to choose between which institutions they're going to work at. They can't work both in the United States and in Canada. Should Canadian healthcare professionals now have to make that choice to reduce the rate and potential contamination of cross-border work that they might do? Should they choose to either work in Canada or the United States?
Provincial premiers and mayors are making extremely difficult decisions and are choosing to do the right things to both protect their own citizens, their own communities, and continue to help our neighbors. We need to get that balance right, and it is going to require some difficult choices. But we know that an essential part of this path forward is not just keeping Canadians safe, which needs to be our top priority, but also helping the world deal with this global crisis, and that's what everyone's trying to do.
We realize that our premiers and mayors right across the country, and particularly in cities on the border, are facing very difficult decisions, and their primary responsibility is to ensure the health and safety of Canadians. At the same time, we recognize that we are facing a global situation, and we have to be there to help our neighbors if we can.
I didn't really get a answer to that question specifically, but I need to move on because there's another answer here that we're looking for. From this report that Premier Ford's talking about with this shipment that was blocked yesterday, are you aware of shipments of personal equipment for protecting medical personnel or any other type of shipment that has been blocked by the United States?
We have recognized over the past weeks a number of situations in which shipments coming from different countries around the world have been delayed, haven't arrived with as many products as we were hoping to see. This continues to be an ongoing problem, but specifically with the United States, we are working with them to ensure that the orders that Canada has placed get delivered. We expect those shipments to come.
We recognize that that is a reality around the globe, that some shipments are coming in with less equipment than we wanted or were delayed because of the actions taken by various countries. But we will continue to work to ensure that Canada receives everything that it needs.
Merci beaucoup. C'est ce qui m'a fait la conférence.
Merci tout le monde. Bonne journée.
And that is the Prime Minister of Canada with his daily briefing on COVID-19, the pandemic, on the same day that the CERB, the Emergency Relief Benefit, is now available to Canadians who have lost their work due to COVID-19. Lots of news there from the Prime Minister. I'm going to start where we left off, if we can, and I'll bring in my colleagues Vashi Kapelis and David Cochran. And this is following a report by City TV that we have not yet confirmed, but it was in an interview that the Premier Ford suggested the province of Ontario was going to run out of PPE, personal protective equipment, soon in the next week because a shipment had been held up at the border. Vashi, the Prime Minister wouldn't say those words, but I understood what he was saying to be that, yes, that is happening. The furthest he would go is to say we expect those shipments to come.
Over and over again to each of the questions he got on this very subject. And just to be specific about what the Premier had said, he identified one shipment from the U.S. that had been stopped over the weekend with 3 million masks. And what he said to City News was that within a week, I think as you went over, Rosie, within a week, personal protective equipment would run out for frontline workers in Ontario. So that's given the number of cases there and the spread of this virus, that's a hugely, a significant thing to say. So the Prime Minister was asked multiple times, do you know that to be the case? Especially that last question there from one of our colleagues at CTV. And he said he would not acknowledge that that specific shipment had been stopped. He was not specific about the United States. He said he understood that to be the case with shipments from around the world. There are delays. Some of them have been stopped. But he would not specifically say, for example, those 3 million masks were held up at the border. However, he did say that discussions were ongoing with people in the United States, in the administration. He identified one specific conversation this morning between Foreign Affairs Minister François-Philippe Champagne as well as Secretary Mike Pompeo. And then he kept saying exactly what you identified there, Rosie. We expect those shipments to arrive. So that's the most we could get out of that. I mean, there are still a huge number of questions around have other shipments been blocked? Is this the only one? I still am not yet clear. Obviously, you know, the number of masks, for example, N95 masks that we get from the United States is significant. I don't know if it's half of all the masks that Canada gets or if it's 3/4. Like, how detrimental is it going to be to the supply in various provinces if there are no shipments coming from the United States anymore? And what exactly happened in those conversations? I know our colleagues have asked for a readout, for example, of the call between Minister Champagne and Secretary Pompeo to try and see where the United States is sitting on this, if there's any propensity to move on the issue at all. I mean, the Prime Minister didn't necessarily specifically address whether or not that's going to change anytime soon, but he did try, I think, attempt at least to sound optimistic that it could.
Yeah, he did, although he also was so careful, as you've spelled out very well there, Vashi, in his language around this, because obviously getting into a blame game or reprimanding publicly the United States for stopping a shipment, I'm not sure how that would go over. It also, though, sounds like this is the case, and that the message has been sent that this has to stop. I'm also curious who stopped the shipment. Was it Border Control that stopped the shipment? Were they directed not to go further? I mean, there's lots of questions around that. David, I'll let you weigh in where you want there.
Yeah, Rosie, it seems to me what you're seeing from the Prime Minister there is a dusting off of the NAFTA negotiation strategy in terms of his public comments. No matter how specific and how pointed the questions get from journalists, he is going to repeat a stock message of that. We are working with the U.S. on this. Raw materials, important essential materials, and essential workers flow both ways across the border. It's in everyone's best interest to resolve this. And he will not take the bait on saying anything that could potentially inflame the U.S. president or enrage Donald Trump. We saw that throughout NAFTA. I believe the motto in sort of the Prime Minister's office at the time was, we don't respond to words, we only respond to actions. Well, now we have very specific actions at a very urgent time that have a very material impact. But because the stakes on this are literally life and death for some people, a lot of reticence, to say something explicit in public that might sound tough and make people feel good, but in the long run, do a heck of a lot of damage in a very delicate situation. So it's a lot of really busy work behind the scenes to try to work on opening up the American border to these medical supplies, while also working furiously in places like China or Brazil or other places where they may make masks to get alternate supplies. I mean, like with NAFTA, Rosie, relying on the U.S. for everything exposes you to a lot of vulnerability, especially with the current mindset of the current administration. So they have to seek as many possible avenues of support as they can. The other bit of news, the CERB. Application process rolled out at 6 o'clock today. Nearly 250,000 people have been able to enroll, so it's a good sign that the system is holding, though as the rest of the country wakes up, especially out west, and starts applying, more and more strain could begin to be put on the system. But while the $2,000 a month that we know is coming starts to roll out, a promise there from the Prime Minister to broaden the criteria of this to help people who have had their hours drastically reduced but are still working, and also to find a way, an issue we talked about yesterday, Rosie, to keep people financially whole if they work in, like, say, a long-term care home but make less going to work and risking themselves than they would if they went off work and got the CERB. A recognition of that problem, a promise to do that, and a recognition that the wage subsidy as currently designed also isn't broad enough. And they're working on that. The quote was, whatever your situation, we are working to get you the help you need. So these programs won't be fully universal because some people like us, we're still working, we're still getting a salary, but it will be as universal as it needs to be, with them expanding the criteria as each new example of someone falling through the cracks comes up.
Vashi, I'll get you to weigh in on the CERB before I go to a guest. Those are the attempts, I guess, to fill in some of those gaps you were talking about.
Yeah, those are the gaps that have been identified to us by so many Canadians who are writing in. Especially, I would highlight those people who have seen their hours or their income drastically reduced but not fully eliminated. The Prime Minister indicated, as David said, that there was additional help, or that they specifically would be addressed in, quote unquote, in the coming days. We don't know how that's going to roll out, or to what degree. Does that mean, for example, that they'll be able to avail themselves of the entire CERB? He was also specific in his language. He said if you're working 10 hours or less, making just $500. He had specific terminology, and then also people who work in care homes, for example, who aren't earning, who would be making more for if they went on the CERB rather than working. So he seemed to have a specific subset of people who the government is attempting to cover with sort of, I guess, a second wave of CERB, but we really don't have the details yet on to what degree they'll be covered and exactly how that will work out, just that it's coming in the coming days, I should say, rather.
Okay, I'll be back to both of you shortly. Thank you very much for that. I should say another little bit of news there to expect at noon. The Prime Minister hinting that Dr. Tam, Canada's Chief Public Health Officer, has, quote, new reflections about wearing masks in this country. So we'll, of course, have that for you at the top of the clock. But as we've been talking about this new benefit, the CERB doesn't cover everyone, including my next guest, Abigail Gelfand, and she joins me in Toronto. Good to see you, Abigail.
Hi, thanks for having me.
So tell me what you do and why you think you aren't going to be caught up with the emergency benefit.
Yeah, so my husband Joel and I run a small community martial arts school in North York. It's called House of Combat. We are working on, I guess, what would qualify as greatly reduced schedule. Our facility has been closed since March 14th, and we've been able to move some of the classes online, but certainly not all. We have amazing support from the community, but we do have members who have requested refunds or a credit. It's hitting kind of everyone across the board, including our members, so we understand that. And not everyone is able to do the online training or benefit from it in the same way. So we're in that position where we're working at a much reduced income, and we have the massive overhead costs of sustaining the facility while being closed.
So a couple questions. Would you say, because the Prime Minister just suggested there that people who are working less than 10 hours a week or getting about $500, I believe he said a month, they will get some support. Would you fall into that category?
For less than 10 hours a week, just about. For less than $500 a month, also just about. But because we're a small business and things vary week to week and month to month, it's very hard to say.
Do you have other employees or with the wage subsidy program that is yet to be in place? Would that be of any help?
So not truly. Our employees are handled as contractors. There are students that we pay to assist with classes only when classes are running in the facility. So it would not be relevant.
And there was also small business loans they've made available. I know you've obviously got a place where this happens usually, and you've got to keep it up and running. Have you thought about using that, or is that a possibility?
I mean, being debt-free is really important to us. We've built slow and steady. We've been around for over 10 years in this capacity. We have 2 young children. We have a rent to pay for our apartment. Debt is just not something that makes sense for us right now, but we'd be open to it because we want to sustain what we've built.
So what are you going to do? Like, how long can you go on without much coming in and without some sort of solution? It sounds like there might almost be a solution for you, but not quite.
Correct. So, I mean, we have kind of like a plan B, and that really involves shutting down our actual facility and kind of working at other people's locations, kind of more of like a private training modality. It would be heartbreaking, and we would not be able to serve as many people as we currently do, and it would lose some of the community aspect. But it would be able to hopefully, when this is over, provide some sort of support for our family, which has to be priority right now.
I only have about 30 seconds, but how stressed are you? Like, how anxious are you dealing with all this on a day-to-day basis?
Anxious, trying not to be. I have 2 young kids under 3, and we're just trying to hang in there and not worry about what's not here yet.
Okay. Abigail Gelfand, you own the House of Combat martial arts studio with your husband there in Toronto. Thank you so much. Listen, I'm hoping for the best for you, and yeah, hang in there, as you said.
Thank you for showcasing us.
Okay, thank you. Stay healthy. All right, as we wait for our briefing from federal officials at the top of the hour, just a reminder that we are expecting some news from Dr. Theresa Tam on the wearing of masks in this country. We'll leave you here on CBC Television. You can continue watching on CBC News Network and CBC.ca. Hello and welcome once again to our ongoing CBC News special. I am Rosemary Barton, live here in Ottawa. If you're joining us on CBC News Network or streaming everywhere on the CBC News app and around the world on CBCNews.ca. Here are just some of the day's big developments on the COVID-19 file. The federal government has now officially rolled out the emergency response benefit for those who have lost their income because of COVID-19. The Prime Minister confirming just moments ago that more than 240,000 applications have already been received. Remember, that program just opened up as of 6 a.m. Eastern this morning. The Prime Minister says millions of Canadians can expect to see that money as quickly as in 3 to 5 days. Here in Ontario, Premier Doug Ford is sounding the alarm in an interview with City Television, City TV, that his province could run out of crucial medical protective equipment in 1 week. He suggested that a shipment of masks had been held up at the U.S.-Canada border. There are also lots of questions to the Prime Minister on that front. Back to the emergency relief benefit, I should point out that the Prime Minister says that they are now looking at additional criteria that would try and capture some of the Canadians who are not captured under what is there now. So trying to broaden that out so as many people as possible can try and get access to the emergency economic relief package. I am joined, of course, by my colleagues, Vashi Kapelis, the host of Power and Politics, and David Cochrane from our Parliamentary Bureau, as we wait for federal officials, cabinet ministers and health officials to come in and talk a little bit more. I don't know if either of you have any bits of news, but maybe I'll just leave on the point that I ended with before, and that is on this thought from the Prime Minister that there might be something new to say around the wearing of masks in this country, which has been a quickly evolving and I think for some people potentially confusing situation. But as of even yesterday, Dr. Tam said she was speaking with provincial officials and looking at all the science and evidence about whether there was a benefit for people who are asymptomatic to be wearing those masks. Vashi, and then over to you, David.
Yeah, the message from the start has been certainly different than what it is now, and that's not just confined to this jurisdiction in the United States. Actually, last week this really seemed to evolve quickly with the Centre for Disease Control there issuing this sort of voluntary national recommendation for everyone to wear masks, and that is very different than what we've heard from our public health officials and even the United States public health officials earlier in this whole pandemic, when they said because at the time the evidence did not point to asymptomatic transmission, it was not necessary. People did not have to wear masks all the time. And that is different from what we've seen in other countries. Take, for example, South Korea, where there was a lot of mask wearing. And so a discussion evolved from that. And what also evolved is the science behind asymptomatic transmission. There are now a bunch of studies, and I preface that by saying I'm not a scientist, just that I've been listening to every briefing from public health officials as well, and they have pointed to an evolution of studies which now shows a higher degree of asymptomatic transmission. That seems to underpin the change in recommendation south of the border, and Dr. Tam has sort of hinted that her position has changed a bit too over the past few days to acknowledge that, and the Prime Minister very specifically said there would be news from Dr. Tam on that. So I'm wondering, is there going to be now a specific recommendation for all Canadians, much like the CDC issued in the United States, to wear these kinds of masks? And if so, that is a major difference from where we started, let's say, even a month ago in the spread of this virus and the advice that was being handed out. I would point to, again, though, the science behind asymptomatic transmission has also changed a lot.
Yeah, that's right. And lots of things have changed very quickly over how public health advice and how different public health officials issue that advice and why they're doing that. It'll be interesting as well. Obviously, the advice from the CDC in the United States is if you want to do this, do this.
Voluntary.
Yeah, so and the other bit of information that Dr. Tam has talked a lot about, David, and then I'll get you to weigh in, is that what cannot happen is that Canadians walk around with medical masks, because that is obviously, while we are hearing these stories about such a desperate need for PPE, Canadians cannot be wearing surgical masks on the street, because that just doesn't make sense when healthcare workers need to be the most protected, David.
Yeah, especially with the United States stopping shipments across the border and telling 3M it can't export things like N95 masks to allied countries that have fought world wars at the American side and have one of the largest trade deals in the world with the American partners, not being allowed to have the medical supplies they've been entitled to for decades now. Yeah, look, the science has evolved on this. Different countries were quick to get to this early. You've seen places like Taiwan, for example, move very quickly in this direction, and they've had a lot of success in flattening their curve, and a lot of people attribute that to masks. A country like Germany is now dealing with this. They are getting pressured to expand their orders for public mask orders. But Germany is also a country that has had a lot of success in flattening its curve and certainly keeping its death rate much lower than a lot of other countries. What those two jurisdictions have in common isn't masks, it's widespread testing and tracing of people. And that has allowed them to get ahead of the spread in a lot of ways by knowing exactly who has it, exactly who they talk to, exactly where they are, and then taking the measures to keep people inside and isolate them from other people and give them the supports they need, medical, mental, and financial, so that they aren't spreading it throughout their communities. So while, yes, there appears to be a growing consensus amongst governments and public health officials that using non-surgical masks in public will help, there is a certainty that testing, tracing, physical distancing, and isolation absolutely work. So I think there has been a reluctance on going all in on people wearing masks in public, because, and Dr. Tam has mentioned this themselves, of this false sense of security. They don't want people to think simply because you have a mask, it protects you beyond something like washing your hands would do in terms of keeping the germ away from you. So it's been a challenging one, and I know some people are really truthers on this and arguing that Canada has lagged on this. But it's not just this country. It's a lot of countries that are slow to come to this, even ones that have been extremely successful, such as Germany, which has fared far better than countries that it shares borders with or very close borders with, well, like France, for example, and even a lot of economic and travel ties to Italy, even without the necessarily shared border. Yeah,
I think the other concern, and you've suggested it there, is that somehow the idea of wearing a mask would then make you less likely to do the other things that public health officials say are in fact more important: physical distancing and washing your hands. The CDC says use a cloth mask if you want to. This is just, it is not a directive. So some sort of homemade mask that you would make, and still practice physical distancing. But if you are going to be in a place where that is not possible, or it becomes more challenging, like a grocery store, like, I don't know, an apartment elevator, then those are the places to wear them. But otherwise, you still have to do these other things. I just want to point on that, Rosie, just quickly. The mask is not so much to stop you from getting sick, though it could be helpful with that. It's to stop you from spraying your droplets everywhere if you're asymptomatic or symptomatic and infecting other people. My mask protects you, your mask protects me, and that has been a consistent public health message in Canada from day one. If you are symptomatic at all, wear a mask so you don't make people sick. Okay, here's the Deputy Prime Minister. We do have a statement from Premier Doug Ford about this stopping of protective equipment. He says that indeed delays in global shipments and recent restrictions at the U.S. border have severely strained Ontario's inventory and left the province with a 1-week supply of medical equipment. We'll talk more about that after this briefing. Here is Chrystia Freeland.
So important. Unless, of course, you are doing essential work like stocking grocery shelves, or you're on the front lines of our healthcare system. And if you are doing that essential work, thank you very much. I know that many Canadians today are struggling to make ends meet. That's why I'm glad to be able to say that applications for the Canada Emergency Response Benefit are now open. To make sure the system works, we are staggering the days Canadians can apply based on their birth month. We Canadians are resilient. We are survivors. I know we will get through this together.
Canadians must continue to practice physical distancing, stay strong and stay at home, unless you are doing essential work, such as filling grocery store shelves or providing health care. I know that Canadians are suffering right now, and that is why I'm happy to announce that Canadians can now apply for the Canada Emergency Response Benefit. To ensure that the system works properly, we are staggering the days for application based on your birth month. Canadians are resilient. We are going to get through this crisis together.
And today we are going to hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, and the Deputy Chief Public Health Officer, Dr. Howard New,
as well as the President of the Treasury Board, Jean-Yves Duclos.
Canada's Minister of Health, Patty Hajdu, is here and also available to answer your questions. Thank you. Dr. Tam, please.
Hello, everyone. As usual, I'll start with the update on the numbers of COVID-19 cases in Canada. There are now 15,822 cases with 293 deaths. Most concerning are new outbreaks in hospitals and long-term care facilities, which are occurring in several provinces. As well, we are hearing of young people being hospitalized due to COVID-19 and people as young as in their 20s dying of the disease. This is a serious health threat to everyone. And although older ages are most at risk, no one can predict when critical illness will strike someone at any age. On the lab front, over 339,000 people in Canada have been tested to date, with about 5% confirmed as positive, and we'll continue to test at a high rate to track where spread is occurring. In good news, British Columbia recorded a lower number of cases this week compared to last. While it is still too early to tell, this continues to encourage us that our collective action can slow the spread of this pandemic. And though there is cause of cautious optimism, we must not relax any of our efforts, from practicing physical distancing, frequent hand washing, and covering coughs to protect our most vulnerable. As I noted yesterday, our collective scientific knowledge of COVID-19 continues to grow. Now that more countries have had larger number of cases and have analyzed transmission patterns, it is clear that transmission of the virus is happening more often than previously recognized from infected people right before they develop symptoms. This is called pre-symptomatic transmission. There is also evidence that some infected people who never develop symptoms are also able to transmit the virus. This is called asymptomatic transmission. We still do not know how big a role pre-symptomatic and asymptomatic transmission play in driving this pandemic, but we know that it is occurring. With this emerging information, the Special Advisory Committee on COVID-19 has come to a consensus that wearing a non-medical mask, even if you have no symptoms, is an additional measure that you can take to protect others around you in situations where physical distancing is difficult to maintain, such as in public transit or maybe at a grocery store. A non-medical mask can reduce the chance of your respiratory droplets coming into contact with others or land on surfaces. So wearing a non-medical mask in the community has not been proven to protect the person wearing it. It is an additional way that you can protect others. Wearing a non-medical mask in the community does not mean you can back off the public health measures that we know work to protect you. So you must continue to practice physical distancing and good hygiene, like frequent hand washing and regularly disinfect high-touch surfaces. And I want to emphasize that it's extremely important that we keep the supply of medical masks where it is needed. Healthcare workers need medical masks. We are still in a very critical stage of Canada's COVID-19 epidemic, and this is no time to relax our preventive measures. As Canadians, we may not outwardly demonstrate our pride, but our hearts are full of it, and we are determined people. When someone says flatten the curve, we say we'll plank it. We are stronger together, and we will get through this together. Donc, ça va bien aller.
So things will be okay.
Thank you, Dr. Tam. Dr. New, please.
Okay. Bonjour.
Good afternoon. As usual, I will start by giving an update on the number of COVID-19 cases in Canada. There are now 15,822 cases of COVID-19, including 293 deaths. Most concerning are new outbreaks in hospitals and long-term care facilities, which are occurring in several provinces. As well, we are hearing of young people being hospitalized due to COVID-19, and people as young as in their 20s are dying of the disease. This is a serious health threat to everyone, and although older ages are most at risk, no one can predict when critical illness will strike someone at any age. On the lab front, over 339,000 people in Canada have been tested, with about 5% confirmed as positive. And we are continuing to test at a high rate to track where the spread is occurring. There's also good news. British Columbia this week recorded a lower number of cases compared to last week. While it is still too early to tell, this continues to encourage us that our collective action can slow the spread of this pandemic. And although there is cause for cautious optimism, we cannot relax any of our efforts, from practicing physical distancing, frequently washing our hands, and covering coughs to protect our most vulnerable. As I noted yesterday, our collective scientific knowledge of COVID-19 continues to grow. Now that more countries have had large numbers of cases and have analyzed transmission patterns, it is clear that transmission of the virus is happening more often than previously recognized from infected people right before they develop symptoms. This is called pre-symptomatic transmission. There is also evidence that some infected people who never develop symptoms are also able to transmit the virus. This is called asymptomatic transmission. We still do not know how big a role pre-symptomatic and asymptomatic transmission play in driving this pandemic, but we do know that it exists. With this emerging information, the Special Advisory Committee on COVID-19 has come to a consensus that wearing a non-medical mask, even if you have no symptoms, is an additional measure that you can take to protect others around you. In situations where physical distancing is difficult to maintain, such as in public transit or at a grocery store, a non-medical mask can reduce the chance of your respiratory droplets coming into contact with others or landing on surfaces. Wearing a non-medical mask in the community has not been proven to protect the person wearing it. It is an additional way you can protect others. Wearing a non-medical mask in the community does not mean you can back off the public health measures that we know work to protect you. You must continue to practice physical distancing and good hygiene, like frequently washing your hands and regularly disinfecting high-touch surfaces. Moreover, I want to emphasize that it is extremely important that we keep the supply of medical masks where it is needed. Healthcare workers need medical masks. We are still in a very critical stage of Canada's COVID-19 epidemic, and this is not the time to relax our preventive measures. As Canadians, we may not outwardly demonstrate our pride, but our hearts are full of it, and we are determined people. When someone says flatten the curve, we say we'll plank it. We are stronger together, and we will get through this together. Things will go well. Thank you.
Merci beaucoup, Dr. New.
Thank you very much, Dr. New. And now I give the floor to the President of the Treasury Board, Mr. Jean-Yves Duclos. Thank you, Christia. Good afternoon, everyone.
Good afternoon, everyone. Le Premier ministre Trudeau a fait trois annonces importantes.
Prime Minister Trudeau made three important announcements this morning. There's some good news economically because the government is going to be supporting all these families and importantly who absolutely need this support given the difficult situation we're experiencing. The first important news is the launch of the site where you can apply for the CERB, the Canada Emergency Response Benefit. 300,000 people have already applied for the CERB successfully through the site this morning. This site is working well, it is solid, and we're going to continue to work very hard in this respect. And it's one of the reasons why the site is working well is because Canadians are disciplined and they're applying depending on when they were born. Today, people who can apply are those who were born in January, February, or March. The second piece of good news with respect to government support for Canadians is that the 2.5 million requests for EI that were done in recent weeks were processed quickly. 2.5 million requests in just a few weeks is more than what the Canadian government generally receives over a year. And out of these 2.5 million requests, 2.1 of them were processed over the past 2 weeks. So in 2 weeks, they received almost the same number of requests for EI as what was done in a year. So as a reminder, those who already applied for employment insurance do not need to apply for the CERB because their requests for EI are automatically transferred to a CERB request. And the last piece of good news is that we all have a role to play in health measures and economically as well. The bank system and credit unions also have a very important role to play. We're happy to learn that they've sizably reduced interest rates on credit cards, and we expect the banking sector to continue to ensure that all Canadians can do their share. We're all going to get out of this crisis together, and we're happy, therefore, to have the cooperation of all economic players. Thank you very much. Thank you, Jean-Yves. Now we're ready to answer your questions. Thank you. As usual, 3 questions from the phone, and then questions from the room and a follow-up question.
Thank you. Merci. Please press star 1 at this time. If you have a question, s'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from Micheline Laflamme de Radio-Canada. La parole est à vous.
The floor is yours. Micheline Laflamme from Radio-Canada. Good morning. Good afternoon. I'd like to know, we recognize that the CERB doesn't meet the needs of thousands of Canadians because they've lost revenue, but what will you do for workers who will be affected? Will this payment be retroactive? And with respect to adjustments to the wage subsidy for companies, they are facing too many obstacles. Jean-Yves? Thank you very much for your question. As we all know, this is an emergency situation that requires emergency measures, and that is why for several weeks now we have done what is ordinarily done in months or years. We've been able to meet essential needs and urgent needs and with respect to support for our workers and companies. The CERB, as the Prime Minister said this morning, we know it covers many people, many workers who need it, and it includes workers who normally wouldn't be eligible for benefits when they're unemployed or they lose revenue. This means all workers who are normally not eligible for EI, freelancers or people who weren't able to accumulate enough hours, if they don't have any revenues for
reasons that are not related to their job situation. But nevertheless, there are still holes in the coverage of the CERB, and that is why the Prime Minister Trudeau said this morning that there were 3 categories of people for which we're looking at in greater detail. The Minister Qualtrough and the Minister of Finance, Minister Morneau, are looking at this. There are 3 particular categories that are being examined right now. People who have lost, for example, a lot of hours of work, but not all their hours of work, and they haven't lost all their income. We're talking about people who may not be earning as much as the $2,000 that the CERB offers, and also students. In some cases, they will be having a hard time finding a summer job in the coming weeks and months. With respect to students in particular, I'd like to remind you what's already in place now to help them. Firstly, there is a 6-month moratorium on the repayment of student loans that they could have had in recent months and years. So they won't have to be making payments over the next 6 months. And interest that would have accumulated over this period has also been cancelled. Secondly, the Canada Emergency Response Benefit is already helping many students. If they've earned $5,000 in income over the year, they may have lost their job in the service sector, or they might have lost their job at the university. So these students already are eligible right now to receive the CERB. And the third thing that we've already done, which is very important as well for students, is the wage subsidy of 75%. This will lead employers to hire and rehire workers, including students, who otherwise would have been jobless and without income. With respect to the wage subsidy itself, as we know, it is very important, and Minister Morneau is working really hard to flesh out all the details. If I could just add something in French, and perhaps Jean-Yves could repeat that in English. With respect to people who are working 10 hours a week or less, this obviously includes volunteer firefighters, who are in a very important category for many Canadian towns. And we've discussed this situation in great detail. Members did bring this question forward, and we're going to solve this very key issue.
So thank you. I'll say that briefly in English. So what is currently happening is that the federal government is reacting in an emergency situation and in an emergency manner, which we haven't seen in the history of the social safety net of Canada. So that means that we are putting into place things like the Canada Emergency Response Benefit, things that would normally take months, if not years, to implement. We're doing this because we know that what already exists is helping millions of Canadians, and we're seeing this morning the impact of that with more than 300,000 applicants already having successfully deposited their request for a CERB. Now, we know, as Prime Minister Trudeau said just a moment ago, that there is more to do. And there are 3 categories of people that Prime Minister Trudeau focused on just a moment ago. First, those that have reduced hours of work but have not lost all of their income or all of their hours of work. So we're mindful of that. Also, those that would be receiving less in income than the $2,000 per month of the Canada Emergency Response Benefit, and those like students that would have a hard time finding a job at a moment in the year at which they would normally be trying to find a job to pay for their expenses. Now, the good news about the students is that although there will be more to come, they have already been many important things for them. First is the delay for at least 6 months of their payment for their student loans. So the capital payments can be brought forward by at least 6 months, and all of the interest that would normally accrue on their loans will not be payable at all. So there will be no interest paid not only in the next 6 months, but that interest that would normally be paid in the next 6 months will not be asked for afterwards. The second thing is that the Canada Emergency Response Benefit is already helping thousands of students right now, because there are thousands and probably hundreds of thousands of students that have earned more than $5,000 in the last year, but that have lost their job, sometimes their part-time job in a restaurant or in a shop or at university as an assistant to their teacher. So there would be students that have lost their jobs, that had earned enough income last year, and that are eligible to asking for the Canada Emergency Response Benefit right now this week, starting today and the rest of the week. And finally, the wage subsidies. Those wage subsidies are very substantial. They will encourage and support businesses towards either rehiring or hiring students that would otherwise have lost their jobs. So this we expect would also be very important for the students in the next weeks, in addition to things that the Prime Minister said we would announce shortly.
Thank you, Minister. Micheline, en suivi.
Follow-up question. Thank you. With respect to the arrival of masks from the U.S. that were meant to arrive in Ontario, but Premier Ford said that this shipment was banned. What about that? And what about the national stockpile right now? I discussed this with Premier Ford 15 minutes ago, before this press conference. We're very committed to working with all the provinces. We're working hard with the U.S. administration to ensure that all the masks that we purchased will be exported to Canada. And we did have positive conversations, and we continue to work to solve this situation, which is so vital to our country. With respect to the situation with health services in general, all provinces are working very hard, as is the federal government. Of course, the situation in Ontario is that we know, one that we know very well. There is very good communication with the provinces, with Ontario, with the Premier. And we're going to continue to work very hard to ensure that people who are doing essential work to protect us at our hospitals do have the necessary equipment that they need.
Sure. So we are very aware of the situation that Ontario experienced with some masks it had purchased in the United States and having some trouble getting them across the border. I spoke about that with Premier Ford just a few minutes before this press conference. And immediately called Ambassador Hillman, who is now very seized of the issue also. More broadly, we have been working throughout the weekend very, very hard with our American neighbors to ensure that medical supplies can continue to flow across the Canada-U.S. border. And let me emphasize, as we emphasized in our conversations with our American neighbors, that flow is a two-way street. The relationship when it comes to medical supplies, when it comes to healthcare between Canada and the United States is, like all aspects of our economic relationship, very balanced, very reciprocal. And that is why a win-win outcome where both parties continue to help each other is the very best outcome. That is the point we have been making. And we had some positive conversations over the weekend, and we're going to continue to have those conversations.
Thank you, Deputy Prime Minister. Next question.
Thank Thank you, merci. The next question is from Alex Valengal from the Toronto Star. Please go ahead.
Hi, thanks for taking my question. Just to expand on that, Premier Ford put out a statement this morning saying that Canada is working to try and get an exemption from the U.S. order on preventing the export of PPE. I'm wondering if you can confirm that and expand on what exactly these productive talks are about that you're having with the Americans.
Yeah, exactly that. We believe that the flow of medical equipment through the supply chain between Canada and the United States needs to continue unimpeded, and that, of course, is a two-way street. Both countries benefit from this, and both countries would lose out if hurdles were to be put in the way of that flow of healthcare support between our two countries. We made that point in repeated conversations over the weekend and today. As the Prime Minister said, we feel we are being heard, and we look forward to a definitive resolution of this situation. It's in the interests of both countries to continue supporting each other when it comes to healthcare. Let me just add, I also spoke to the global CEO of 3M, Mike Roman, who has been doing a great job. The company is taking a very, very responsible position. They understand the very special place they are in right now. And I would really like to commend the company for its approach and for its very constructive relationship with Canada.
Alex, follow up?
The Prime Minister mentioned shipments from other countries have been delayed and there's been stuff missing from shipments that have arrived. Do you have any more details on which countries had shipped things that were delayed and exactly how much stuff has been missing from the shipments that have arrived in recent days?
Look, as Minister Hajdu, as Patty pointed out at one of these press conferences last week, it is really a wild west when it comes to buying medical supplies right now. This is a global pandemic, and every country in the world is doing its best in a truly fierce competition to get medical equipment. Canada, working very closely with all of our provinces, is working really, really hard in the international marketplace to get all the supplies we need. It's hard, but that's why we have to work even harder. And it is also why I am so grateful to all of the Canadian manufacturers right across the country who are stepping up to figure out ways that we can make the medical equipment, the testing equipment that we need here in Canada. So it's a two-pronged approach. We are working hard, but it is absolutely very, very tough right now.
Thank you, Deputy Prime Minister. Operator, next question, please.
Thank you, merci. La prochaine question de Marie Vassel.
Next question from Marie Vassel, Le Devoir. Good morning, Ms. Freeland. I'd like to continue in French. Can you confirm that your government is seeking an exemption from the U.S. order that ceases the export of PPE? And you also said,
definitive resolution.
can you tell us when you expect an answer in this respect from the U.S., or how much time you're willing to wait? Yes, I can confirm that Canada's position is that we must continue with the U.S. to have a flow of medical equipment
which we've had until now, I'd like to highlight for Canadians what the Canadian government highlighted in their conversations with our U.S. counterparts, and that is this is a two-way street. Canada exports a lot of medical equipment, and we also have healthcare professionals that do extraordinary work in the U.S. It's good for Americans. At the same time, the U.S. exports medical equipment that is necessary for us. We need to continue to have this situation, which is in the interest of our two countries. It's a win-win situation that we have right now, and that is what we want to keep. We've had many conversations over the weekend, and we had them today as well on this issue. And these were positive conversations. And we do hope that it will be quickly possible to definitively solve this situation. All right. In terms of 3M, since you had a meeting with them this weekend, did you obtain any assurances? Because they seemed reticent to export masks to Canada. Did you obtain any assurances that 3M, that they will receive orders that we made? I don't agree with what you're saying in the question. It's not up to a company to ignore their country's laws. It's up to a country to solve its issues in this respect. As for 3M, we had a constructive conversation. 3M's approach, well, I appreciate it greatly. They've been very responsible, and we discussed what 3M needed from the U.S. administration to continue to export its masks to Canada. We also had discussions with 3M about a central point, and that is there are mutual dependency. Our two countries depend on each other. Thank you, Deputy Prime Minister.
Starting with Julie, CBC.
Yeah, Ms. Freeland, you were saying that you spoke to Doug Ford 15 minutes before you came here. He talked about some masks and some trouble at the border. So how many masks? Where were they coming from? What was the trouble? And exactly how are you going to resolve this?
I'm going to let Premier Ford talk about the specifics of this particular province of Ontario purchase as he chooses. We did speak about the fact that some masks that the province had purchased in the United States were having some difficulties in being shipped across the border. And I pledged to the Premier that the federal government would do everything we can to get those masks into Canada, and we will.
All right. I have other questions for you, but unfortunately I have to move to masks now. Theresa Tam, about the cloth masks that you say is probably beneficial for Canadians to wear right now. Why would it have taken so long, considering we know how infectious this virus is, and we know that people can carry it and not know it? So a mask, how could that have hurt? Why didn't you say weeks ago, wear a cloth mask?
So the evidence is actually still quite weak. What the evidence that just came to light in, I would say, the last 10 days actually came from a few studies about asymptomatic and pre-symptomatic illnesses. So I think, as I was trying to explain yesterday, there's several different types of studies, and they were published, a number of them in the last little while. So they are very specific studies in long-term care facility, the Diamond Princess cruise ship, and a hospital setting, for example, and a study from Singapore. And then that last one was released on April 1. So you have to take the evolution of the evidence as rapidly as possible. And so the viral load studies show that, yes, people who are just before they develop symptoms have high viral loads. And so that tells us that the possibility is there that they can transmit. We still don't know exactly how important transmission from the pre-symptomatic or asymptomatic people are in driving this epidemic. There are other epidemiologic studies as well, for example, in the Seattle long-term care facility. So these are very recent studies that's just come out on this particular virus. And so we very rapidly try to integrate that latest science. On the issue or the area of wearing masks to protect others, which is what we're talking about is non-medical masks, which may be made of cloth, for example, for people making it at home. As an added layer of protection is a bit like covering your cough. I think the Special Advisory Committee looked at the literature around the use of masks for this sort of source control, and it's actually mainly from influenza studies, and they are not very clear. So we want everybody to be aware that the science is not certain, but we believe in we need to do everything that we can. It seems a sensible thing to do. So I think we recommend that Canadians can take this additional measure at instances where social distancing is difficult to maintain. So our strongest message really is that you must continue to do social distancing, that 2-meter bubble, and hand washing, stay home, you're safe. All of those things are the effective measures. This may add a layer of protection to prevent you from transmitting someone to others before you actually know that you have the illness. So I think that needs to be very clear. And the other key message, of course, is that medical masks right now, as you've just heard about the challenges with supplies, that they must be preserved for our health workers and others who are looking after patients.
Thank you, Doctor. Next question.
And with CTV National News. Over the last couple of days, you have said that people shouldn't wear medical masks. So you're asking people to essentially wear non-medical masks now as a way to prevent themselves and others from spread. I'm just wondering if you could be clear for Canadians on the guidelines when you say non-medical mask. What are you talking about? Because now, hardware stores are closed. Lots of Canadians at home might be looking to make a homemade mask. So what are you suggesting they wear? What are those guidelines?
Yes, so we'll be, we have some suggestions on our website, but we'll be putting out more additional tools for people to think about. So we're talking about things that are readily available in anyone's home, things like cotton shirts, sheets, bandanas, and other materials. But we're also going to tell people things that they shouldn't use as well. And we have our engineers looking at the evidence on those. But I think it's simple things that not complicated, and preferably no sewing required, because I, for one, can't sew anything. So if you can get a cotton material, like a T-shirt, you cut it up, you fold it, and then put elastic bands around it, other sort of non-medical facial coverings that we're talking about. And we will see what kind of tools we can provide in short order.
I just wanted to ask you a follow-up question on test kits. Over the last number of days, we've been asking you a lot of questions about shortages of personal protective equipment like masks, ventilators. How many test kits do we have in Canada at this moment? And can you give us a sense of how many test kits we might need should we see a dramatic number of cases increase and a number of people getting sick? Like, how many test kits do we have and how many do we need moving forward?
I think, as I've said, Canada is testing at quite a high rate compared to many other countries, and we're pulling out all stops again to improve the capacity in Canada. It's not a matter as simple as just a kit. Obviously, there are throughout that pipeline of testing, there are swabs, there are other pieces, but there are also reagents that people need to use to extract materials from the swab and then test it. So there are many different components, and right now Canada is doing well, but we are trying to make sure we get the right reagents. Like all supplies, the global supply chains are very difficult. So we are looking at how can we look at made in Canada solutions. And also we're at the moment looking at validating things like more rapid test kits, little equipment that can be then sent to, for example, the north or more remote areas that can't send their samples to a public health lab. And some of the initiatives are actually changing the testing capacity at the bigger labs into more high throughput machines and procedures. So it's not a matter of just counting kits. So again, efforts are all out on that, as well as, so that's mainly tests for the detection of the virus through PCR. And we're also, of course, working on looking at the antibody tests.
Thank you, Dr. Mike Global.
I guess I'm going to follow up with that. So why aren't we doing more testing? Is it because of the lack of resources or lab supplies or personnel? Is that why we're not testing a lot of these people who are asymptomatic or not pre-symptomatic?
Yeah, so we have, through our federal, provincial, and territorial discussions, guidance provided. So for sure, we want the supplies to be utilized in the most effective way possible. So that does mean testing in situations where you're most likely to be finding infection and in the most high-risk situations. So like in outbreaks, in cluster detection, in healthcare workers, in highly vulnerable communities, including Indigenous communities. They're absolute must, and we have to do well in long-term care facilities, for example. For others, we've already provided instruction that if you're sick, you must stay at home. And the others are practicing social distancing to the effect that even if you're pre-symptomatic, you shouldn't be, within the distance to spread it to other people, and with maybe added protection like these homemade masks. So the test doesn't actually drive potentially the public health action. So you want the test that you have and whatever you have on populations where you are going to make a decision after you've actually got the test result. So if you're just staying home anyways, we're going to be prioritizing others. We are looking, of course, that people are very interested in serologic testing, which will help us look at the level of immunity in certain populations and a little bit further on in our studies. And so that's a different approach, but it is one that we're pursuing as well. But the rate at which we test is quite high, but it is a bit different depending on where you're in Canada. So we want the resources to go to areas that are, for example, experiencing the highest activities as well.
Okay, and so we're just learning about this asymptomatic, pre-symptomatic things, but how are we going to get back to normal without higher levels of testing? Like if people are walking around with this virus that don't even know it?
Yes, so obviously when you're walking around, practice social distancing, of course. And so it's an extremely good question. And you're going to hear many sort of opinions, if you like, as to how many proportion of your population is asymptomatic and got the infection, which is precisely why we need to do studies, as time goes on. Because right now our focus is to tackle this actual outbreak. At some point in the near future, we will be looking at how do we apply serologic testing, for example, to look at the level of immunity in the population. And those kind of studies will let us know to what extent the virus has been affecting people in a very mild way or, very little symptoms, if at all. So those do have to be done, and it has to be also done in a global setting as well.
Thank you, Doctor. We'll now turn back to the phone. Operator.
Thank you, merci. La prochaine question de Raymond
Next question from Raymond Fillon, TVA. Question for Dr. New about wearing non-medical masks. I didn't hear you say about recommendations. Is this something you're recommending to Canadians or not? Thank you very much for your question. To start, I'd like to highlight a few key points. Firstly, about non-medical masks. It's very important to say it's absolutely critical to keep medical masks for people who are on the front lines, healthcare workers, namely. That's one clear point. Second, another important point is that even though we're talking about non-medical masks, it's really important to keep physical distancing measures. We don't want to give people a false sense of security. Oh, they're thinking I'm wearing a mask and I don't have to practice physical distancing or wash my hands. No, that's not the case. It's still critical to continue with proper hygiene and public health measures. Third, if we're talking about non-medical masks, it fits with what we've already said. You may be sick and coughing. You still always have to cough into your elbow. That's another measure. Perhaps you'll be coughing into a non-medical mask. Another important point is that if you do wear a non-medical mask, it's more for protecting others. It's not for protecting yourself from others. If you do cough, these respiratory droplets will be trapped and not contaminate others who are in front of you. The Special Advisory Committee on COVID-19 did reach an agreement, and all the premiers agree that this is another measure we can take. It's something that can help us, but it's not necessarily a recommendation. It's advice. Thank you. Very good. It's not a recommendation as such. Okay, follow-up question for Mr. Duclos. We're receiving a lot of emails about voluntary firefighters. You talked about this Friday. What is happening? Is it official now that volunteer firefighters will receive the CERB or not? The answer is yes. Okay, thank you.
Okay, next question.
Thank you. The next question is from Christy Kirkup from the Globe and Mail. Please go ahead.
Hello, good afternoon. Thanks again for doing this. My question pertains to the now confirmed cases, particularly in First Nations that have confirmed cases in recent days. And I know the Chief Public Health Officer has already said that even one case in Indigenous communities has the potential to be devastating. I'm just wondering, I know the government has already earmarked some funding, $305 million for Indigenous community support, but what is being done in the immediate term to support communities like one in Northern Ontario that doesn't have water and now has this confirmed case of COVID-19?
Thank you, Kirsty. I spoke with Chief Bellegarde this morning about that particular case up in northwestern Ontario, and also will be speaking with Chief Fiddler later today, sort of in my neck of the woods as a Northern Ontario Member of Parliament. And I will say that according to Chief Bellegarde, the person is self-isolating. You're right. It is way more difficult to self-isolate and to practice regular hand washing and regular cleansing when you have a situation where there maybe aren't those kinds of facilities or people are crowded in overcrowding situations. I know my colleague Minister Miller has been working very carefully with all of the First Nations leaders around their own pandemic plans, of which First Nations communities have, and is working to make sure that they have the resources they need to provide the appropriate medical care and the appropriate follow-up, as well as additional supports if people cannot properly self-isolate. I can't speak to this specific case in terms of where they're at, but I do know that Chief Bellegarde feels very confident that our government is taking this seriously and that we're there to support First Nations and ensuring that they have the measures they need when cases are identified. And I'll turn to Dr. Tam to speak a little bit more about Indigenous communities.
Yes, we, of course, work with the medical and public health side on the response, so working with Indigenous Services Canada. And our role has been to, of course, provide guidance and how to manage outbreaks in those kind of settings. And so we've also issued guidance for public health actions in more remote and rural settings as well. And those do have to be adapted to the realities of what's on the ground. And I think we're offering support also for communities where it is difficult to isolate in, for example, crowded conditions. So those are some of the measures that we are pursuing.
I'm just wondering, as a follow-up, you mentioned that in some communities that embracing the public health advice like physical distancing can be very difficult or more difficult than in other locations. I'm wondering, in a community where there might be an overcrowding problem and a person might have difficulty self-isolating, what options would be available, or is there a specific plan being looked at to potentially remove people from communities that just don't have the luxury of trying to figure out where to self-isolate?
Thanks again. I know that Dr. Wong, who is the public health officer with Indigenous Services Canada, has been working with First Nations communities on plans to deal with positive cases for some time. Certainly, there's always an option of providing additional supports for alternative living spaces for a whole variety of circumstances. Those have to be balanced carefully with the additional risk that it may pose to Indigenous communities. Of course, taking people out of their community prevents a whole host of other challenges that sometimes are equally risky for the particular individual. So I can't speak to this particular case. I did understand from my conversation with Chief Bellegarde that this person is isolating at home, but of course each circumstance will be different and each community will be different. Safe to say that these are the kinds of considerations that are being considered by First Nations community leaders as they work through their pandemic plans with Indigenous Services Canada.
Thank you, Minister. Operator, last question, please.
Thank you. Merci. La prochaine question est de
Next question
la presse canadienne.
from the Canadian Press. The floor is yours. Good afternoon.
For Dr. Tam or Minister Haidu, I got really confused. So if it's not a recommendation, these non-medical masks that you should be wearing, you said you should be wearing when you're getting close to people, even though it's not protecting you, it's protecting other people. If it's not a recommendation, what exactly is it that you're saying? And why did it take you 3 weeks to come up with this?
So as I said, some of the emerging evidence have only recently been published. So we are incorporating those as we are going along. And also in the international community, you've seen that different public health experts and different countries around the world is looking very intensely at this particular issue as we have done. And so really is as of yesterday, with all the chief medical officers of health of the provinces and territories, we are issuing essentially a statement which sort of essentially state that Canadians can wear these coverings or non-medical masks if they can't maintain physical distancing. So it is a permissive statement, and essentially depends on the circumstances, because we want to make sure people are practicing the public health measures that have already been recommended and not substitute this. And so this is an added layer that someone can take to further prevent spread to others.
And if I can just add to that, I think what Dr.
All right, we are
Tam
going
has
to
said
leave
in
this
the
federal
past.
briefing. Let me leave you with the highlight, though. Public health advice now from federal officials is suggesting that if you go to places where you cannot adequately physically distance, that you wear a cloth mask, not a medical mask. This is only advice, not a requirement, but it is a significant shift. Just wanted to highlight that. Let's bring you now to Quebec. The Quebec Premier, François Legault, giving an update on his province, and I will leave it there for today.
When we look at ICU, we're at 164 people, an increase therefore of 10. That means that in the regular hospital beds, there are 2 people less. So that's good news. When we look at the hospitalization rates, it's encouraging. Of course, it's one day. But what that means is that if we have a few days like these ones, we could say that we're getting closer to the peak and getting back to normal, closer to getting back to normal life. But we're not sure. We can't take any chances. We can't loosen any of the measures. We have to continue doing what we have to do correctly, and that means staying at home as much as possible. For the equipment, we now have for 14 days of gloves, 13 days of N95 masks, 10 days of surgical masks, and 6 days worth only of gowns. So as you can see, our efforts are a lot on the gowns right now. We are looking at the possibility of using washable gowns more. That already exists in hospitals. Of course, it would allow us to reuse those gowns. And we're working very hard still, and I talk about it every morning with Quebec companies that are trying to get material out to us. But it's going to take a few weeks yet to be able to get to that. A word on pregnant women. We know that right now there's only one hospital that does not allow having someone with women who are coming to give birth. That's the Jewish hospital. So we're having a look at things for women who want to change hospitals so that they are able to change hospital. But at the General Jewish Hospital, there are a lot of cases of COVID-19, so there are good reasons why this rule exists. But I want to be very clear. There is no intention on the part of the government of extending these bans to any other hospital. So I want to reassure all women who are pregnant right now, apart from the Jewish hospital, you will be able to bring your partner with you when you give birth. Yesterday, I talked to you about Quebec companies. This afternoon, Jean Boulet, the Minister of Employment and Labour, is going to make an announcement of $100 million to help those companies that could take advantage of the present situation to do training for their employees. I think that this is the ideal moment, taking into account that work in a lot of businesses is on hold. I think, doing training, amongst others, all the training on working from home, everything that's digital. Of course, things will be changing a lot in the next few months, and so we are going to, the government, with this program, pay up to 100% of both wages and expenses, which will allow us first to prepare ourselves to the reorganization of labor, but also to keep more employees who will continue being paid with their wages. So I think that this is a really nice program. And of course, training in a knowledge-based economy is very important and will become even more so. My daily thanks are going to be for Quebecers as a whole. We saw yesterday that Quebecers are those who have responded the best in North America to the guidelines. I think that it's beautiful to see, on the one hand, people who are not in essential services who stay at home, and on the other hand as well, it's beautiful to see, and I get all sorts of testimonies as well in our hospitals and grocery stores, police officers, even in banks, cashiers, everybody is doing their job and is getting through this crisis. And I want to tell you that I'm so proud of the Quebec people. I would like to end by repeating our 3 priorities and by specifying that if we respect these 3 guidelines, we are saving lives. So this is something that is important. It is not anything that is banal. So if you don't leave your home, if when you do go out, you always stay 2 meters away or 6 feet away from other people, and when you come back home, very important, wash your hands with soap. So I count on you all, and I feel like saying too, in April, let's not loosen any thread. Let's keep it all tight. We hope that it's going to be the last difficult month, but the month of April will be critical. The following days, the following weeks are going to be critical. We're going to remember this month of April for a long time. But let's not loosen, let's not slacken things during the month of April. English.
We may see the light at the end of the tunnel, but we must continue to do everything we can to win the battle against the virus. We must also prepare the restart of our economy. Our Minister of Labour, Jean Boulet, later this afternoon will announce a new program that will help companies train their employees to new technologies, to new organization. And I repeat my 3 priorities: to protect ourselves, don't go out unless it's necessary. If you do go out, keep your distances. And when you come back home, wash your hands. That's how we'll save lives. Thank you.
Merci, Monsieur le Premier ministre.
Thank you, Mr. Premier. We will start the question period. My first question for you, Mr. Arruda. You've probably seen a few minutes ago, Dr. Tam for Health Canada now recommends the wearing of non-medical masks for the population, not to protect oneself, but to make it that people who are asymptomatic or pre-symptomatic be able to limit the spread of the virus. This from Canada's Chief Public Health Officer, Dr. Tam. What do you think about this? I have the same position. I am the Minister or the National Director of Public Health of Quebec, and with my different counterparts. The difference is that today we said it can be a means, and I did write up that it's still a draft, for interprovincial purposes. But what is said in the document, and I find it really important, what is proven is to stay home as much as possible. Having physical distance, as we remind people every time, wash your hands, protect the most vulnerable from infection by not visiting them, etc., and to covering one's mouth with fabric or one's sleeve. In fact, what is very important is that procedural masks must remain for health workers. What is indicated here is that in no way does wearing a mask that is homemade should replace any other measure. If people do that, they are not going to be protecting themselves. The mask that you wear that, it has to be well adjusted, it has to be washed regularly, for which you have to decrease contact with the eyes or the mouth, that can be used